GERD, thoracic endometriosis, gut health. What's the link? What's the link between thoracic endometriosis and upper tract digestive symptoms such as GERD? How does gut health tie into it? Now, if like me, you've experienced symptoms like rib pain, acid reflux, heartburn, nausea, hiccuping, burping, and stomach pain, and you find some of these symptoms to be cyclical, i.e. they interplay with menstruation, and you have endometriosis, then it's worth schooling yourself on thoracic endometriosis, diaphragmatic endometriosis to be precise. You may have seen my post on my recent gynecology appointment where I shared my digestive symptoms and made it clear that they occurred with menstruation. And the gynecologist at a BSGE accredited endo center no less told me that thoracic endo was unlikely and that she would happily prescribe me anti-acid meds. No surprises there. Gynecologists gaslight you about gynae symptoms. So it's not shocking that they'd gaslight you about symptoms that aren't technically under their jurisdiction. Diaphragmatic endometriosis is the most common type of thoracic endo. It can cause symptoms ranging from respiratory to digestive. That's because of the diaphragm's location and function. The diaphragm is the muscle responsible for breathing, and it also assists with things like urination and defecation, weeing and pooping. It sits beneath the lungs and acts as a separation between the thoracic, chest, and abdominal cavities. So it literally sits above your digestive organs. When you inhale, the diaphragm contracts and flattens, pushing down on the abdomen, allowing space for your lungs to expand. This pushing down action that you get with diaphragmatic breathing can help with digestion as it effectively massages your digestive organs. Also, your esophagus or food tube runs through your diaphragm. The esophagus is the muscular tube that moves food from the mouth down into the stomach, and it literally runs through an opening in the diaphragm down into the stomach. So given all of this, it isn't news that diaphragmatic endometriosis can cause digestive symptoms too. Because of its location, the diaphragm is impacted and has an impact on your stomach and digestive health. The symptoms experienced with diaphragmatic endometriosis, whether digestive or respiratory, will depend on where endometriosis is located. They include pain in the upper abdomen, pain in the lower ribs, feeling sick or experiencing nausea and vomiting, digestive discomfort, shoulder pain and pain in the side of the neck, and difficulty or pain when breathing. If endometriosis lesions progress through the diaphragm, they can intercept the lungs. Now, most gynecologists will dismiss thoracic symptoms, or they'll misdiagnose. For example, asthma or GERD, like in my case. This seems to happen due to a lack of knowledge or education or resources. Currently, there are no set medical pathways to thoracic endometriosis diagnosis and treatment. The NHS doesn't even acknowledge thoracic endometriosis as a condition, which is an absolute travesty. Now, in speaking to digestive symptoms, that's not to say that if you have them, you have diaphragmatic endometriosis. Endometriosis on or just near the bowel can cause a host of digestive health issues. Inflammation alone can disrupt bowel function. If your bowel isn't happy because of endometriosis or any other reason, it can disrupt the rest of the digestive tract. Low stomach acid can be another cause of symptoms. Acid can be low due to long-term use of anti-acid meds, bacteria infections like H. pylori, or bacteria overgrowth, as with SIBO. See my post on SIBO. The long and short of it is, if you have symptoms and they're cyclical, and you have or suspect you have endometriosis, investigate the possible root causes of your digestive health issues and consider seeking support and advice from a thoracic endometriosis specialist. Next up, I'll be talking about my personal diaphragmatic experiences and sharing more on the methods of investigation for thoracic endometriosis. So stay tuned.